Hi, Dr. Samuel. I'd like to present Mr. Patel. I just saw him in exam room 2. Mr. Patel is a 38-year-old Indian male. He's a grad student who presented to the office for a checkup because of his increased urinary frequency. He's had some recent weight gain and some general malaise. He was diagnosed with hypertension about a year ago, and he's got type 2 diabetes. That was diagnosed 5 years ago. He also suffers from anxiety, a diagnosis he received 13 years ago. Mr. Patel states he's had increased thirst and increased urinary frequency over the past month. He states he has gained about 15 pounds in the past 3 months, and that's an unplanned weight gain. He states he has a busy school and work schedule, and therefore he frequents fast food restaurants and takeout a lot. He reports that this has started about a month ago for the increased thirst and increased urinary frequency. And like I said, the weight gain has occurred over the past 3 months. He doesn't report any significant cardiac history or respiratory history. His family history, his father has hypertension, and his mother has a history of high cholesterol and diabetes. He's awake, alert, and oriented, answers my questions appropriately, states he does not check his blood sugar regularly. He says barriers to this are that he's just too busy and that he seems to have an aversion to needles. He also has complained of fatigue, like I said, for quite a while. Head and neck were unremarkable, denies any vision or hearing issues, doesn't report any cardiac or respiratory issues, denies cough or shortness of breath. Patient did not report any GI issues. GU, like I said, he's had increased urinary frequency over the past month or so. As far as his energy level, he says he's felt really just tired and kind of blah, as he says. He denies muscle ache, soreness, or anything like that. And also denies any skin issues. He's able to get by financially on his graduate student stipend and his teaching salary. He also seems to have adequate social and family support from his girlfriend and his family members. Now, Mr. Patel is 5'9" and weighs 233 pounds. His temperature was 37 degrees Celsius today. Blood pressure was 146 over 94. Heart rate was 75. Oxygen saturation was 98% on room air. My assessment is that he's got poorly controlled hyperglycemia. We sent him for labs prior to his visit today, last week, and his A1C came back 9.3. This compares to 7.5 about 6 months ago. He also had a fasting glucose of 210 last week. This was compared to a previous visit of 142. He does get blood glucoses regularly at his self-monitoring at home when he does do it in the 200s. Also, Mr. Patel has continued essential hypertension that is being inadequately managed. Blood pressure again today was 146 over 94, and the patient-provided readings have been consistent with that from his home monitor. As far as his plan goes, I would recommend that he modify his diet. His diet mainly, like I said, consists of takeout food and fast food because of his busy schedule. I think that's contributing to his conditions. I would provide some information about the benefits of a largely plant-based diet and the benefits of doing some nutritional planning and food prep. And if possible, I could refer him to a nutritionist if his insurance will cover that. Also, self-monitoring has been an issue for Mr. Patel. I would explore some options with Abbott Medical to provide maybe a Freestyle Libre for his continuous glucose monitoring. Sometimes that can be provided at little or no cost. This could dramatically improve his blood glucose monitoring and allow him to treat his diabetes more effectively, as well as make him more aware of his food choices. I also recommend modifying his medications as follows. For his essential hypertension, I would add an ACE inhibitor to his diuretic. Like I said, he's on hydrochlorothiazide right now, and he takes 50 of hydrochlorothiazide. So I would put him on Zestoretic, which is a hydrochlorothiazide and ACE inhibitor combination. This would give him 10 milligrams of lisinopril of that ACE inhibitor and 12.5 milligrams of hydrochlorothiazide. This would be taken once daily by mouth. I would write the prescription for 30 days and allow 2 refills. For his type 2 diabetes, I would recommend changing him to from the metformin to Metaglip, which is a combined glipizide and metformin. This would allow a combined anti-hyperglycemic effect. This would be 1 tablet twice a day and it would be 2.5 milligrams of glipizide and 500 milligrams of metformin. I would also allow 2 refills. I would educate the patient about known side effects of the medications, as well as to tell him to seek medical attention immediately if he has any signs or symptoms of hyper or hypotension or hyper or hypoglycemia. And I would ask to see him back in the office in 90 days for follow-up. Do you have any questions or comments or suggestions for me?